study, the Partnership for Domestic Violence Prevention, was a pilot study funded under El Centro, and it's a CBPR, Community-Based Participatory Research Project, that Rosa initiated, has completed the study in itself, but has really continued with this program of research, and I'll be able to give you a little bit of update. Intimate partner violence is an important health disparity in Hispanics. Approximately 1 out of 4 women is affected, worldwide by intimate partner violence, and intimate partner violence is associated with very significant health and both physical and mental health outcomes. Hispanics do experience health disparity in intimate partner violence. Recent sort of population-based findings have found that the incidence is twice as much among Hispanics, and that there are more severe forms of abuse and more severe sequelae of the intimate partner violence in Hispanic families. So I don't think I need to show you this. Why focus on Hispanics? As we know, we're more and more of the US population every day, so the rest of the country, even those parts of the country where the Hispanics are not the majority, are really starting to pay attention to the need. If we have these health disparities, we really need to pay attention to them, because it's just going to, as the population grows, the disparity is going to grow. So this project, as I mentioned, is CBPR, is Community-Based Participatory Research, and it was a close collaboration between El Centro, another academic center that we have at the School of Education, and a really innovative program that Miami-Dade County has called the Coordinated Victims Assistance Center. This is a really wonderful program. Miami is not known for being progressive about a lot of things, but this is something that's really fantastic, because what they've done is anybody who's a victim of domestic violence has multiple issues that they need to deal with, right? From legal to physical to psychological to housing, etc. What the Miami-Dade County has done is put all of these services under one roof, so that when a person is experiencing domestic violence, they can go to this Coordinated Victims Assistance Center, and there are 24 different agencies under that umbrella, and they can receive all the services they need in a one-stop shop. So they get triaged to everything they need. And so this has been a wonderful partner for us in El Centro, and we've worked very closely with them in a number of initiatives. So as you see, the team really consisted of people from both the academic setting and also from the community settings. And one of the first things that Rosa did was set up a community advisory board, which included people from a lot of different kinds of perspectives. So people from the legal perspective, people who are survivors of domestic violence, advocates, the state attorney's office, trauma resolution, family counseling center, children's counseling centers, the Florida Immigrant Advocacy Center, and another academic setting that we work with, the Department of Pediatrics, the University of Miami Mailman Center. So it was really a community advisory board that really represented a broad range of interests and perspectives. And the specific aims for this particular project was to lay the groundwork for really building an enduring community academic partnership. And this is very challenging because, as we know, grants are not enduring, right? Grants have an expiration date. And yet, one of the problems with really creating community academic partnerships is sustainability, is the ability to be able to continue the work that we do beyond the life of a grant period. So Rosa was funded for this grant for 1 year, and that 1 year finished a good 8 months ago, and she's been able to sustain this partnership, which hasn't been easy. It really, that once your money dries up, then you're working on goodwill and foraging around for other funding, et cetera, right? So the first specific aim was to lay the groundwork for an enduring community academic partnership that's aimed at promoting the prevention of domestic violence among Hispanics in Miami-Dade County. And the second specific aim was to assess what were the needs and the priorities according to the community itself, right? So if ultimately, everything in El Centro ultimately is about developing culturally tailored interventions, the idea here is to develop an intervention that really is addressing what's important to the community. Because if you want something to be sustainable in the community, a good place to start is what's important to them. So she used really a number of different methods. All of it is under the CBPR approach. CBPR is not a methodology, it's really an approach of partnership. And within it, you can use very many different kinds of methodologies. And what she did was she did focus groups. She did a community forum, which not only was used to disseminate information, it was also used to collect data, and I'll share that with you a little bit. And she also did a secondary data analysis, which I'm not going to present today because it's still in process. But basically, she's finished collecting that data. She took all of the intake data from the CVAC Center, from the Coordinated Victims Assistance Center, all of it on paper, and was able to get students and volunteers to enter that data. And she's in the process of analyzing all of it. So this is sort of a timeline. As I said, she had a year to do the study. She started the study in February of 2010. She had to lay the groundwork a little bit before that. And then she, by February, by the time the grant funding was over, she had started to do some of the dissemination activities. So she did a number of focus groups with the total number of people were 76. In the focus groups, she had two different kinds of groups. She had groups of just regular community people, some of whom were victims of domestic violence, some of whom were just people who were interested. And she also did focus groups with people who work in the area of domestic violence. And this is just some of their demographics. The vast majority were Hispanic. And as you see, country of origin, as we've mentioned a couple of times today, in Miami, we really do have sort of a variability, a heterogeneity in terms of origins of people from Hispanic countries. About a third of the participants were men, and about 40% of them were service providers, and about 40% of them had been affected themselves by domestic violence. So in doing the focus groups, there were basically three main themes that emerged. Who were the priorities? Like the focus of the focus groups was, you know, what are the priorities of the community and how should we address domestic violence? So one of the main themes was, who are the people that we really should be addressing? Who should we be focusing our interventions on? Who's our main priority? The second one was the idea of what was causing the problems and what was also protective, and really a theme that emerged was culture as a double-edged sword. I alluded to that this morning. And the third theme that really came out was, in order to have an impact, you need to break the pattern. Rompiendo el patrón, breaking the pattern of domestic violence. So I'll talk a little bit about each of those issues. So in terms of what the priority subgroups were, this is according to the focus groups. Going from left to right is really sort of the order in which the priority was set. So people felt that immigrants were really at highest risk because of their legal status. They were very vulnerable because of financial barriers, because of language barriers, lack of education, social isolation, and fear, that these were the kinds of factors that people felt put immigrants at great risk for domestic violence. The groups were also very, very interested in youth. That was a very high priority for the members of the focus groups. They felt that youth were becoming more violent as time went on. We were hearing in Miami recently, in the last couple of years, we've really just had some horrible things come out in the news of really, really severe kinds of homicides related to domestic violence, et cetera. And the sense that, that youth were really at risk, and that youth was a time, not only were they very much at risk, but the people in the focus groups felt that youth was a time that you really can make an impact. And that families were important to this. The other priority subgroup, sort of in lowering order of what was a priority for this focus group's members, was people who were from low incomes because of the financial barriers. Men, people felt that it's really important to address men, and that men are ignored in this situation. And actually, a fair number of the people who had come to CVAC as clients, I think about 30% of them are men. so that there really was a need to address men, and that sometimes that there's a sense of unfair treatment. Another priority subgroup that was identified was gay and transgender. There was a sense among the focus group members that when there was abuse, it tended to be more aggressive. I don't know that that's been backed up in the literature, but that's what these folks felt, and some of them are, treatment providers. That there was a lack of recognition, and that's certainly true in the larger literature, that really there hasn't been the attention there needs to be to the issues of intimate partner violence among sexual minority groups, and that there's a lot of discrimination and rejection, and that's certainly something that the literature holds out as well. And there was also a little bit of focus on vulnerable adults, people who are elderly, pregnant, etc. So these were the priority groups that were identified by the focus groups. The issue of culture as a double-edged sword, I think, is really something that's very interesting, in that there really was a sense in the focus groups, there really was a sense of saturation in terms of doing the content analysis, that this was a theme that came up over and over again. The issue of culture as a double-edged sword. And so one of the first issues that they brought up was family upbringing. That the kinds of attitudes and the kinds of values that perpetuate domestic violence were being passed down generation to generation. And even women themselves were saying, we are setting up our sons to do the same things to their partners in the future as men in our generation are doing to women in our generation. That there's been, and then on the other hand, that with acculturation, there's been a loss of family values, and that really the family values are protective, they need to be preserved. And that the culture has a way, the family way of upbringing has a way of encouraging people to stay in abusive relationships. And it was like what Rosina was talking about this morning when she was talking about the CEPA study, that family values in Hispanic families tend to really emphasize that you stay in a relationship, that you just see yourself through it no matter what. Faith also as a double-edged sword, so there were positive aspects of faith, but a lot of people had very negative sorts of experiences, especially people who had been victims of domestic violence, had very negative interactions with the faith community in terms of being really encouraged, feeling a sense of not being validated by the faith community, that no matter what, you got to stick to your marriage, and that the sense that the church promoted these inequities within the couple. But on the other hand, the sense that faith was an important protective factor, in the sense that the faith community, that churches could be a good venue for interventions. Gender roles, also culturally based gender roles as a double-edged sword. On the one hand, you have sort of the gender inequity where the woman in the family is sort of the submissive one. But on the other hand, the woman is sort of the heart of the household and she's the strong one. The same things that Rosina was talking about this morning in terms of machismo, that on the one hand, machismo is problematic because of the inequities in the sense of, I can do whatever I want and I'm in charge, etc. And on the other hand, the protective aspects, the positive aspects of machismo of protecting the family. Adapting to American culture, acculturation, stress as a major stressor, as something that was really difficult. And it's interesting because in a place like Miami, where really Hispanic groups are the majority, not only the majority, but also politically quite powerful, there's still a sense that immigrants and people who are in the process of acculturation are experiencing tremendous stress. Imagine how much greater it is in a situation where you're isolated. And I imagine it's somewhat similar here to Miami in that the majority is Hispanic, so there isn't that same sense of isolation. Nonetheless, acculturation is very stressful and it's very problematic. And one of the issues that's been found in the literature and that's been repeated in Rosa's research, not in this study specifically, but in other studies, is that one of the things that women are put at risk for domestic violence as acculturation is heightened, because just like children tend to acculturate more quickly than the parents, a lot of times women are acculturating more quickly than men, and that the difference in the gender roles becomes exacerbated because of the differences in acculturation. So that's the issue of culture as a double-edged sword. The third issue that they brought up, the third theme that came up in the focus groups was this idea of breaking the patterns, rompiendo el patrón. That there really was a need to, in order to break the pattern, what the focus groups brought up was that there was a need to have a community-wide response, that you really needed to not just be addressing little pockets of people or one family at a time, that you really needed to change values at the larger level, at the level of a community. They really were very interested, along the lines of being interested in youth, in looking at teen dating violence prevention. That was really something that was very important to these groups, that they wanted to see domestic teen dating violence addressed through the schools, but in keeping with Hispanic culture, the pattern was empowering vulnerable women to really help women understand, know their rights. And also, a lot of times women are afraid to report because they're afraid that their family is going to be completely broken up if they report something, and that's a fear as well. It's not only a fear for their own safety, but a fear of what's going to happen to the family. So to really educate people about the process of what happens when you report domestic violence was really important. And then trying to really draw from promising programs that were out there, and people were identifying some of the ones that they really wanted to focus on as well. So the next thing that Rosa did was she took the findings from, she took these sort of themes from the focus groups, and then she did a community forum. And so we had a community forum out in Miami Beach. 150 or so people participated and attended the program. And she gave these little clickers to about 50 random people, 50-something random people in the audience. And she took a survey using the clicker technology, right? And so she said, okay, this is what our focus groups found. They said that these, and she didn't put it in any order, they thought that these 5 groups were the ones that were the most important. What do you think? What, in order of priority, what are your priorities? And fantastically, it's great when things converge. The order of priority was exactly the same in the clicker group, in the community forum, as what she found in the focus groups, which is that the majority of people, the largest priority area was youth. The next one was immigrants. Next was low-income families. And then gay and transgendered, and then men, and that one was reversed from the focus groups. But the other ones were really in the same sequence. So it's really nice when things come together, and you really got the sense that for the Hispanic community, the people in the focus groups, the people in the community forum, you got this same idea that they really wanted to focus on youth. And again, Rosa said, okay, so given these possible topic areas, or which are the ones that you think should be addressed in a domestic violence intervention? And as you see, they felt, family was overwhelmingly endorsed. 86% strongly agreed that family should be addressed. 82% felt that gender roles should be strongly addressed. You see that faith was not so strongly endorsed, which really reflects what the focus groups were saying, that this faith issue, works both ways. On the one hand, yeah, we're a very faith-oriented community, but on the other hand, faith has sometimes not been the best venue or the best way of addressing domestic violence. So this CBPR approach has been an approach that is very promising in terms of being able to form an enduring process. So what's happened now is that Rosa took the results from these groups, from the focus groups and from the community forum, and she said, okay, the consensus is that we need to do something about youth. Let's do something based on teen dating violence. And the community feels that it should involve the school. The community feels that it should involve the schools. And sometimes life just throws nice things at you, and just when that finished, the NIH put out an RFA for teen dating violence. And so Rosa responded. She has a protocol a proposal under review for an R21. She also submitted a Robert Wood Johnson Foundation Nurse Scholarship Award, which is similar to a K award in the NIH, to do this teen dating violence through a school. She's going to be working with Hialeah High School. Hialeah is, I think, 99% Hispanic, of which the vast majority is Cuban. It's an extremely Hispanic area of Miami. And we found out yesterday that she got the RWJ award. So it's going to happen. So, you know, she wrote to all the community partners. The community partners are really excited. So now this community partnership is going to be able to move on to a next stage where they actually do now get to develop an intervention. And so the project that she's going to be doing is to, you know, she's sort of got the scaffolding in terms of what are the content areas and what are sort of the levels of intervention at the school, at the family, and at the school and at the child level. And what she's going to be doing in this project that's coming up next is to use focus groups within the schools of both teens and school officials and parents to get feedback on, okay, so how exactly, you know, how do we need to shape this intervention some more? And the next phase, if she does receive the R21, would be to actually do a pilot study in Hialeah High School with students. So this is Rosa's contact information, and I'd be happy to forward any questions or inquiries for her, and I can try to address any questions you have. I wasn't part of this project, but I know quite a bit about it. Or a little bit about it. Okay. Thank you very much for all your attention.